Hey guys, welcome back to my channel, The ENT Resident. Today, I'll be talking about the different types of tonsillectomy. In my previous class, I discussed about the different techniques or the different methods that we know of tonsillectomy. You can also now purchase my notes. I have added links in the description. Okay, let's get started. So, there are two different types of tonsillectomy that we need to know about, and they are hot tonsillectomy and interval tonsillectomy. Now, these are very important Viva questions for your practical exams when you get a long case on acute tonsillitis or chronic tonsillitis, and inevitably you'll end up in these questions. So, what is hot tonsillectomy? Hot tonsillectomy is when you perform an immediate tonsillectomy during an active infection. Usually, when do we perform this? This is usually done following a case of peritonsillar abscess, also known as quinsy. Or second, we can do it in a case of severe airway obstruction occurring due to acute tonsillar hypertrophy. These are the two indications of hot tonsillectomy. Now, what are the advantages and disadvantages of performing hot tonsillectomy? Advantage is that it will give you immediate relief of symptoms in a case of peritonsillar abscess or the severe airway obstruction. Second advantage is it will avoid repeated infections or abscess drainage procedure that may happen in a case of interval tonsillectomy where you wait for a period of time for the active infection to subside for you to perform tonsillectomy. So these are the two advantages of hot tonsillectomy. Now, coming to disadvantages, there are more disadvantages here than advantages. First of all, these cases involve a higher risk of bleeding due to the acute infection that is happening at this moment. Especially the chances of post-operative hemorrhage increases. So even if you perform hot tonsillectomy, you should definitely monitor your patient more in case they end up developing secondary hemorrhage or reactionary hemorrhage. Second, these cases are more difficult to perform dissection of the anterior pillar from the tonsil. This is because of the inflamed and the vascular tissue. So, this makes dissection of the tonsil difficult. Third, you have increased post-operative morbidity and pain in the patient. Fourth, when you're performing the surgery, say in a case of peritonsillar abscess, it may lead to rupture of abscess intraoperatively, and that will completely ruin your field of dissection. Your whole surgical field will be ruined, and it will be very difficult to find your plane of dissection and continue the surgery. And the last disadvantage is if the abscess has ruptured, the patient may end up aspirating the pus, and this can lead to the development of aspiration pneumonia. So these are all the disadvantages of performing a hot tonsillectomy. So unless this is absolutely required, we will not perform a hot tonsillectomy. Second type is interval tonsillectomy. Now, what is interval tonsillectomy? This is when you perform tonsillectomy 6 to 8 weeks after an acute infection has subsided. This is what is usually followed in different cases. So, when do you do this? This is usually done following an episode of peritonsillar abscess or a case of severe tonsillitis where immediate surgery was risky. Now, there are more advantages over here. The advantages being there is a lower risk of bleeding and other complications in these cases. Second, because of the resolved inflammation, it will be much easier to perform the dissection, find your plane of dissection between the tonsil and the anterior pillar and continue it. And third, patient definitely has better recovery in these cases. And this advantage of interval tonsillectomy is the risk of developing recurrent infections during this 6 to 8 weeks of waiting period that you have. So, there are more advantages here rather than disadvantage in a case of interval tonsillectomy. So, these are the two different types of tonsillectomy that you need to know about. In my next class, I'll be talking about the different steps of tonsillectomy. What is the position that you put the patient in, and what are the different steps and what are the different instruments you're using in each of the steps of surgery. See you in my next video.